So now I would like to introduce Dr. Nicole Allard, who is currently the Acting Director for the WHO Collaborating Centre for Viral Hepatitis at the Doherty Institute, and is also an S100 prescriber GP with a focus on Hep B and culturally and linguistically diverse communities, who's going to talk a bit further on the GP perspective in regard to the cascade of care. So thanks, Nicole.
Thanks, Isabel. So I did put a few graphs together, which is kind of almost against what we're talking about today, which is about patient self-management. But it's really just to talk about why we're not actually going to get there just by looking at data versus actually we need patients to be in the driving seat of their own illness. So I don't have any conflicts of interest to declare, and I just wanted to acknowledge especially Jennifer McLaughlin. These are some of her slides, and the WHO Collaborating Centre team. So what can we learn from cascades of care? And then a little bit about hepatitis B and hepatitis C. And I haven't put anything about HIV, so apologies. But I do come from the Centre of Viral Hepatitis, not HIV. So this is the concept of a cascade of care. Cascades of care have been around since just before 2010, there were HIV cascades. And it's a concept of all people with the disease and people who are tested and aware of their status in the case of viral hepatitis, those who are enrolled in care, on treatment, retained on treatment, and virally suppressed. And really the last 5 stages of this cascade requires someone to be engaged with their healthcare. As John alluded to, there's different ways of getting people engaged, and not everyone's the same. So some people are really into numbers and tracking their health status, and some people just want to turn up and be told kind of what's next and what follow-up they're required. So let's think about hepatitis B, because if one could have a favourite virus, that is my favourite virus, which is not always a good thing to admit. But anyway, so if we look at Australia, we have around 230,000 people estimated to be living with hepatitis B, so about 1% of Australians. And we estimate that only 22% are engaged in care and 9.3% are receiving treatment. And we have a network of about 400 GPs across Australia who can prescribe treatment. And in terms of hepatitis B, it's disproportionately seen in communities who are born overseas, particularly in the Asian region or in Africa, and also in Aboriginal and Torres Strait Islander peoples. So combined, those two groups make up nearly 70% of people living with Hep B. And then we've got other people who are living with hepatitis B. And I mean, there's a diversity, obviously, in the population of who's living with hepatitis B in terms of where they're from. But then also within that, there's different levels of health literacy, different levels of computer literacy, different ability to use an app or to engage in a sort of electronic self-management tool. And when we look at the cascade of care, this is just from the National Viral Hepatitis Mapping Report for 2018, we see that in terms of people who've ever had a viral load test, so of all the people living with hepatitis B, only 50% have ever had a viral load test. Only about a third have had one in the last 5 years, and only 1 in 5 have had one in the last year. So we've got a lot of work to do in terms of engaging with hepatitis B, because it's unique in some ways that we're going to monitor for very long periods of time, and unlike HIV, we're not going to necessarily initiate treatment. That long-term monitoring means someone might be having regular blood tests for 15 years before we decide to put them on treatment. And during that time, they might partner, they might have children, they might move states, they might move GPs a couple of times. And in all of this, what we actually need to do is get to a stage where there's more empowerment for the individual to understand what tests they need and when they're needed. If we just look at viral hepatitis more broadly, and this is from a recent analysis of some data, so 1.6 million patient records in 3 PHNs in Victoria. And if we look at actually who should be screened for viral hepatitis, we've got quite large numbers. So basically, 250,000 people met the screening criteria, and only 72,000 of them had a hepatitis test. So this is people in the first stage of the cascade, going from someone who's at risk of hepatitis B to being diagnosed with hepatitis B. And this too, you might say, well, what's that got to do with patient management? They don't even know that they've been diagnosed. But considering in hepatitis B is more common in families. If we have people engaging in care, they might be able to advise family members, encourage testing within their communities, etc. And I think if we want to look at missed opportunities for people who had a late hepatitis B or a hepatitis C diagnosis, and when we mean late, we mean 2 years prior to liver cancer, cirrhosis, or death. So a cirrhosis diagnosis is essentially a missed opportunity. Most of them had 70% of them had blood drawn, 88% had had GP consultations, ED presentations, hospital admissions. So 90% of them had missed opportunities for care. If we then actually look at people who have diagnosed hepatitis B and hepatitis C, again, many different missed diagnoses for care, both in general practice and across the spectrum. So systems miss people with viral hepatitis, and that is another call to action that we need to empower people who have a diagnosis to know what sort of healthcare they need. And it's not for everyone. People have different thresholds, different abilities to negotiate systems, but we have to work on basic ideas of patient self-management. And this was just looking, probably less interesting at the kind of screening, the percentage screened in the various categories according to age. And just flicked past that unintentionally. And what we see is that in the older age group, there was a whole lot of people who really should have been screened. I mean, the highest group was in 30 to 34, and that's probably actually partly the effect of women being screened in pregnancy for viral hepatitis. Now, when we look across this spectrum, we think, we might make judgments of who's tech savvy and who's not. And so we might think of who the app applies to. And I guess we just have to think of needing a variety of tools to engage with people. There are other low literacy tools like the Hepatitis B story, for example, which is very pictorial and has a single page tear off. And that might be suitable for some people, and the LiverWell app might be very suitable for others. So just thinking about hepatitis C, and this is just some work from the Kirby, and this is just looking at uptake. So to 2018. And of course, 2020 was a bit of a year where healthcare generally across the board suffered in terms of both testing and initiation of treatment. But we can see that there's a variety of success in terms of how many people have been treated. And this is also from a similar Kirby study, but this is actually just looking at a group of injecting drug users and their engagement of whether they've ever had a sample of blood, a hepatitis C test, whether they've then gone on to have RNA testing, who was RNA positive and who entered treatment and completed treatment. So this is really just a lot of graphs to actually impress on you that there's a lot of work to do, and that without the consumer and without a consumer both involvement but consumer motivation or patient motivation, we're not actually going to improve a lot of these care statistics. I just wanted to leave you with a couple of quotes from a recent study we did in women with living with hepatitis B in pregnancy as they experienced the prevention of mother-to-child transmission. And I think Fatu, says it's a disease and grows and progresses in time, and there's no treatment towards it. It's a forever disease. Of course, there is treatment, but Fatu is unaware of it. And then Yuri, who's had hepatitis B for more than 5 years, and says, well, they say I'm a carrier, so does that mean I have it, right? So she's not actually really particularly sure of whether or not she has hepatitis B. And this is work done by Nafisa Youssef in our group, interviewing women and their experiences. So in conclusion, I just think we have to think of creative ways to engage people in self-management. I think it's really important to consider technology. It's important to consider written information. It's important to consider good holistic care by general practice, because we're certainly not going to improve those cascades of care without this in play.
That was perfect, and thank you so much. And it was actually such an insightful way of looking at the fact that, there's so many different avenues where you can capture people, and for every doctor and for every patient, that's going to look different as to what that is. And there's, these are two options and two tools, but it is a very sort of insightful and sobering, really, look into what kind of gaps there are. So thank you so much. And I thought that now might be a kind of a good time to have a little bit of a break from presentation, and just to sort of have a little bit more of a look at the LiverWell app and some of its functions as a potential tool that could help address some of the gaps that Nicole's just talked about, and then I'll talk about some resources that are available to assist with that briefly as well.
The new LiverWell app has the latest tools and information with added functions that make it even easier to manage your liver health. Navigate the app in English, Arabic, Burmese, simplified Chinese, Thai, and Vietnamese. You can add upcoming appointments and see your past appointments. Add your own list of medications with handy prompts for the medication names, schedule them, and set reminders for when to take them. You can add your own test results, track, and even graph them to compare, as well as your own notes to keep them all in one place. You can call the Liver Line for friendly and confidential information about your liver health. Link to LiverWell news, events, and liver health information. Sign up to the LiverWell e-newsletter and keep in touch with links to LiverWell's social media. So download the new LiverWell app today, and for more information, go to the LiverWell website, liverwell.org.au.
And so if you do have clients and patients that you think this is something that could be useful for them, or it's just something that you want to have as a tool on hand, there are some resources that you can order online from the LiverWell website to use in your clinic, including a poster and an A5 tear-off prescription style pad, and that just has some sort of brief information and prompts for people around what they can use the app for, and where they can download it, as well as sort of some quotes and testimonials, both from doctors as well as community members who've used the tool.